Welcome to the Environmental Services Training Program. In this module, we will explore the regulations set by OSHA Occupational Safety and Health Administration and the CDC Centers for Disease Control and Prevention that directly impact our work in hospitals. Let's start by breaking down the role of these two regulatory bodies. OSHA is a federal agency responsible for ensuring workplace safety. For us, in environmental services, this includes guidelines on how to handle hazardous materials, prevent accidents, and avoid exposure to harmful substances. The goal of OSHA is to protect you, the employee, by providing a safe working environment. Hospitals are complex workplaces where hazardous chemicals, blood-borne pathogens, and physical risks can be found in every corner. It's critical that we understand OSHA standards to prevent workplace injuries and illnesses. On the other hand, the CDC primarily focuses on public health, but in healthcare settings like ours, their guidelines are crucial for controlling and preventing the spread of infections. The CDC's infection control guidelines are aimed at protecting both patients and healthcare staff from infectious diseases. These guidelines are especially important in our role as environmental services professionals because we are responsible for maintaining a clean, sanitary environment. Proper sanitation and disinfection of surfaces, correct handling of contaminated linens, and proper waste disposal are all CDC-regulated tasks that we perform daily. Now, what happens if these regulations aren't followed? Non-compliance with OSHA standards can lead to penalties, including fines for the hospital, potential litigation, and even workplace shutdowns in extreme cases. More importantly, non-compliance puts lives at risk. If we fail to follow OSHA safety protocols, not only could we get hurt, but our patients and coworkers could be exposed to dangerous pathogens or hazardous chemicals. Similarly, failure to adhere to CDC infection control guidelines could lead to hospital-acquired infections, which can result in extended patient stays, severe health complications, or even fatalities. Hospital-acquired infections are a leading cause of preventable deaths in healthcare settings, and environmental services play a significant role in mitigating this risk. If a room isn't properly disinfected after a patient with an infectious disease leaves, the next patient to use that room could become infected. Both OSHA and CDC have set clear standards for training. OSHA requires all workers in healthcare environments to be trained on blood-borne pathogens, chemical hazards, and personal protective equipment, PPE. This means you'll learn how to protect yourself from exposure to infectious materials, as well as how to use PPE correctly. CDC guidelines are more focused on infection control measures, like hand hygiene, surface disinfection, and the proper handling of contaminated materials. Finally, compliance is not just about ticking off boxes on a checklist. It's about creating a culture of safety in our workplace. Everyone, from environmental services staff to medical professionals, must understand and respect these regulations for the hospital to function effectively and safely. In summary, OSHA ensures your safety, and the CDC ensures that our patients and the public are protected from infections. These regulations are interconnected and serve as the backbone of the safe, effective functioning of hospitals. As an environmental services worker, your adherence to these guidelines will help keep everyone, patients, staff, and yourself, safe and healthy. Let's now move on to a more detailed examination of OSHA regulations specific to hazardous materials and CDC protocols for infection control, and see how these are applied in our daily tasks.